Dear friends, welcome to the show Talk with Your Doc. I'm Dr. Prashant Jani, and with us is today Dr. Laura Power. She is an obstetrician and gynecologist at Thunder Bay Regional Health Science Centre in Thunder Bay, Ontario. In one of our previous episodes, we have covered women's health related issues. We talked about perinatal care, neonatal care, and maternity care. Today we are going to talk about menopause. Menopause is one of the important phase of women's reproductive stage of life, and it is associated with certain signs and symptoms. It can make one discomfortable or uncomfortable. It can lead to stress or even depression, and hence it is very important to understand menopause, its signs and symptoms, and how to treat them. And Dr. Laura Power, being an expert obstetrician and gynecologist, is going to guide us about the same. Thank you, Dr. Power, for coming to the show.
Thank you for having me.
Please tell us about various stages of women's reproductive life. Like it starts with the menarche, and how does it progress further?
So basically, yes, you're right. It starts with menarche. So that's at the time of puberty when women get their first period. And then after that, we just generally call it the reproductive stage. So women may or may not have children, but they certainly have the ability to get pregnant. And then after that, they reach menopause. So in that area, there's a few different kind of transitions. Menopause, the official definition, is not having your period for 1 year. So 1 year from the last menstrual period. That is kind of the menopausal period. After that is called postmenopause, and before that is called perimenopause. So that's the transitional time.
So what age usually that transition happens, like perimenopause, menopause, and postmenopause?
Typically, perimenopause starts in a woman's 40s, but it can happen before that or after that. Every woman is different. The average age of menopause in Canada is around 51 to 52 years old.
And then perimenopause is just before that then? How many, 1 year, 2 years?
Everybody's different. So unfortunately, I don't have an answer for that. Everybody asks me that question, how long is this going to last? But perimenopause typically starts in a woman's 40s, and then it lasts until her last menstrual period.
Okay. And how long the menopause lasts then?
So menopause is just that brief period of time when women don't have a period for 1 year, and then it's called menopause or postmenopause.
Okay. Now, what is the induced menopause?
Induced menopause is when women have their ovaries removed for any reason. Sometimes it's because of a medical condition that requires the ovaries to be removed because we don't want any hormones or estrogen or progesterone.
For example, any condition like?
Some types of breast cancer do benefit from having the ovaries removed. And there are other hormone receptive tumors that might benefit from having the ovaries removed. Other problems can be if there's a problem with the ovary themselves. So sometimes there's a mass on the ovary and it might not be cancer, but the ovary still needs to be removed.
So then in that case, it gives us the same symptoms as the menopause, even in the earlier age?
Even in the earlier age. So our ovaries produce hormones for women. They produce estrogen and progesterone. And so when those ovaries are removed, both of them, because if you just have one ovary, the other ovary takes over and will provide enough hormone. But if both ovaries are removed, then that's called induced menopause. And you can also have induced menopause from certain medications, but that's reversible.
Okay. So, for example, which medications can cause menopausal symptoms?
So medications can be called, I don't know, Lupron is a typical one. It's an injection that can be used, especially in cancer patients. It's a medication that's used both in men and in women.
Okay. Now, what are the signs and symptoms patient can experience during the premenopausal phase and then menopausal phase?
So the most obvious symptom that women experience in the perimenopausal phase is a change in their menstrual cycles. So typically, a woman's periods will become closer together and heavier. And then they start to get farther apart until eventually they stop altogether. Other symptoms that are more common are hot flashes and night sweats.
Can you please tell us about hot flashes? What is it and how does one recognize them?
So a hot flash Well, first of all, every woman experiences these symptoms differently, but typically a hot flash is this feeling of heat or flushing that starts in the chest and then kind of rises up into your face. It's very uncomfortable, and it causes redness, sweating to the point of soaking through clothes. It can be very bothersome. A night sweat is the same thing, except it happens at night, and it's often accompanied with chills after, because when we're sleeping, we're more susceptible to temperature changes. And if we get really hot, and then we kick off the covers, and then we're really sweaty, we then get really, really cold. And that's accompanied with nighttime wakening as well.
So it starts just around the perimenopausal age and then goes through the menopause. Does it go to the postmenopausal age also?
Unfortunately, it can. So when the period stops, that's called menopause, but the symptoms of menopause can extend many years after the last menstrual period.
So it's individual, like everybody is different?
Everybody's different.
And there is no particular cause for it?
Well, we don't know what the cause is. We think it has to do with hormone fluctuations, and it also has to do with our blood vessels and how sensitive we are. So some women experience a couple hot flashes a day, but those are particularly terrible hot flashes. And other women tell me they get like 50 a day, but they're not that bothersome. So everybody's different.
The night sweat also is the same, it can last longer than?
A night sweat is typically caused by the same problem or the same pathophysiology, but it can be more bothersome because it's also interrupting sleep.
So what happens, like when patient interrupted sleep means they don't get the sleep, or they get extended sleep, or they wake up in the middle of the night? What happens?
Well, not only do night sweats wake women up, but also another symptom of menopause is difficulty falling asleep or early morning wakening. And by early morning, I mean like 2 or 3 o'clock in the morning, not a typical, 5 or 6 o'clock in the morning.
So they have difficulty to even to go to sleep.
So there's a lot of sleep disturbances that can happen with the hormone changes with menopause.
Right. So what one can do to overcome these symptoms?
So the standard treatment for hot flashes would be hormone therapy. And so that is replacing estrogen and sometimes progesterone, depending on a woman's health needs.
Now, does the menopause cause the headache?
Menopause can definitely cause headaches. So some women got a lot of headaches, especially migraines around the time of menarche or during puberty. Other women get headaches just at the time of their menstrual cycle or their period. And then some women get headaches just with their hot flashes or with their perimenopausal symptoms.
So they can be any time?
It can really be any time. And unfortunately, if a woman had more headaches around the time of puberty, she's more at risk of getting headaches at menopause.
Thank you, Dr. Power. We'll take a short break and we'll continue our discussion. Please stay back for the next part. Thank you. Welcome back to the show Talk with Your Doc. And today with us is Dr. Laura Power, and we are talking about menopause. Dr. Power, you were mentioning about headache. Is this headache associated with the night sweats, or it can come anytime?
Unfortunately, the headaches can come anytime. They just seem to happen more frequently during the perimenopausal time.
Now, how about memory loss? I've heard that some people get memory loss. Is it associated with menopause or perimenopause or postmenopause?
So it's true, there are cognitive changes or changes in our brain that happen during the perimenopausal time. Studies show that women often have trouble with word recall. So these changes are not permanent, and they don't necessarily affect our intelligence at all, but women often find that they can't remember a certain word or particularly names. And that's temporary, so that's good news. And we don't know if that's just because of the hormonal changes in our brain or if it has to do with lack of sleep or something similar.
But then they come back to normal?
Yes, they will go back to normal.
And I've heard some people get depression during the menopause.
So mood changes are very common in the perimenopausal period. Overt depression is also very common. It can happen to anyone, but if women have had depression in the past, they're more at risk for having depression during the perimenopausal time as well. And it's important that women bring this up with their healthcare provider if this is happening.
So mood changes, depression is a common symptom?
Yes.
It's not related to anything else but the menopausal thing?
Well, the changes in our hormones can affect our mood. Most women will attest to cyclic mood changes during their time of menstruation.
Right.
Puberty is a particularly difficult time. So it does make us a little bit more susceptible to mood disorders, but depression in and of itself should be treated regardless of a woman's perimenopausal status.
So what is the role of birth control pills in perimenopausal phase of life?
So birth control pills have estrogen and progesterone in them, and those are the two hormones that our ovaries make. In the perimenopausal time, we're experiencing lots of hormonal fluctuations. Birth control pills are essentially hormone replacement, but in higher doses than the typical hormone replacement therapy that women might hear about on the news or in magazines. The reason that women in the perimenopause need a birth control pill or a higher dose of steroids or hormones is because their bodies are naturally making more hormone. So they do need a little bit of a higher dose. So that's why we often prescribe a birth control pill when really we're just using it for hormone replacement.
So they are during the perimenopausal, not during the menopause or postmenopause?
Exactly. So during the perimenopausal time when women are still experiencing some type of
Ovulation.
bleeding and ovulation, the birth control pill is a better option than hormone therapy.
Now, about the vaginal dryness, it is said that it is one of the symptom of or sign of menopause. Can you please tell us something more about it?
So vaginal dryness is a very common symptom that women come to see me for. It happens especially during the perimenopausal and menopausal time, more so in menopause. It also happens to breastfeeding women actually because their hormones are quite low as well. The vagina needs a lot of estrogen in order to function properly, so if you don't have a lot of estrogen, then you can experience dryness. And this dryness leads to problems not just with pain with intercourse, but also frequent bladder infections and just general discomfort.
So urinary incontinence is common with the low estrogen, is that?
Urinary incontinence does happen more frequently as well, yes.
And then it can lead to more urinary tract infections problem.
Potentially, yes, yeah.
So with the birth control pills in a perimenopausal, all these symptoms can be avoided, like dryness and urinary incontinence probably?
Well, vaginal symptoms are special because hormone replacement therapy or the birth control pill, they affect our body systemically. So usually it's a pill or a patch or a cream that we're using, and it gets all through our body except the vagina is sort of like a separate compartment, and sometimes we need just a vaginal estrogen, so that's just like a cream or a tablet.
Okay. Now, so birth control pills, what are the advantages of taking the birth control pills?
So birth control pills as a method of contraception or birth control are really not that great. They have a fairly high failure rate. But as a method for controlling symptoms of abnormal bleeding or perimenopause, they are fantastic. They are very safe. They are a very old medication, and so we have a lot of studies showing their safety. The birth control pill does not increase the risk of breast cancer at all. Does not, no. It decreases our lifetime risk of ovarian cancer, which is one of the most deadly gynecologic cancers out there. And it decreases our risk by over 50%. So it's
ovarian cancer also.
Yes. It also decreases our risk of endometrial cancer as well. And then for reasons that we're not sure, it also decreases our risk of colon cancer. So as a method of symptom control, the birth control pill is quite safe.
So they are given during the perimenopausal phase?
Yes. So we give these to women who are not menopausal, who are in the perimenopausal period. At that time, a woman's risk of a heart attack or a stroke or a blood clot is fairly low. Not every woman is a candidate for the birth control pill because of that, but for the most part, it's a safe option. Now, if you're older, then that's too high of a dose of hormones, and that does increase your risk of a heart attack or a stroke.
So what sort of investigations you do before you give birth control pills to the patient?
Well, the investigations that we do before we prescribe a birth control pill vary according to the patient and the symptoms that they're having. So sometimes a pap test is required, or an endometrial biopsy, which is an office procedure that checks for cancer or pre-cancer cells inside the uterus.
Right.
Sometimes we do an ultrasound just to look for any pathology or problems with the uterus itself, but sometimes all we do is a blood pressure check.
Okay. And then what is the dose of these birth control pills then?
All birth control pills on the market are low dose now.
Yeah.
So the doses don't really vary very much
They
in
take
terms
the
of
one
brand.
tablet every day?
Yes, it's usually just one tablet every day. Every package looks different, but it's pretty much the
And
same
for
thing.
how long they take these tablets?
Again, it just depends on the type. So some women take the pills every day for 3 weeks and then take 7 days off to have a regular period. Other women will use it extended and just get a period once every 3 months. And some packages only have 4 sugar pills, so instead of a 7-day break, it's a 4-day break.
We'll take a short break and we'll continue our discussion on the next part. Please stay back for the last part of the session. Thank you. Welcome back to the show Talk with Your Doc. Today with us is Dr. Laura Power, and we are talking about menopause. Dr. Power, you were talking about birth control pills, which are low dose nowadays, and they are very safe, and usually women have no problem in taking it. Are there any side effects or possible side effects of taking birth control pills for longer period?
So side effects of the birth control pill can include blood clots or risk of a stroke or risk of a heart attack. These are in women who are at high risk for these things already. So depending on your age and other medical problems that you have, and if you're a smoker or a non-smoker, your doctor may decide that the birth control pill isn't for you. But for the most part, these are safe medications to take. There has been no long-term effect that is negative on taking the birth control pill. In fact, the longer you take the birth control pill, the less your risk of cancer of the ovaries are. So in terms of the amount of time that you take it, there's really no adverse effect. It's more just with the initiation or starting the medication and your baseline risk of getting a blood clot.
So you start at the perimenopausal age and continue as long as you want?
As long as you want, yep. Most women will stop taking it on their own after a few years. The natural age of menopause in Canada is around age 51, 52. So by then, you should have stopped taking the birth control pill.
Okay. And then those will reduce all the hot flashes, depression, dryness, all the symptoms will be?
Most of the symptoms of menopause can be controlled with a birth control pill. Sometimes we need additional medications like treatments for depression, and vaginal dryness is often treated with an additional cream.
What is hormonal replacement therapy and how it is different from the birth control pills, and when does we take it?
Hormone therapy is for women who are menopausal. So perimenopausal women still get their period. They do require a higher level of hormone, which is available in the birth control pill. And overall, that level of hormone is fairly low. Hormone replacement therapy is even lower. So it's a very, very low dose of estrogen and maybe a progestin in order to help control hot flashes. But by then, women shouldn't be having their period anymore, and so they don't really need a higher dose of hormone.
So this hormone replacement therapy helps those symptoms?
Hormone therapy does help those symptoms.
So what is the constitution of hormone replacement therapy? Like what does it contain, estrogen, progesterone? Or?
It always contains estrogen. And for the most part, there are only 2 types of estrogen that are available in Canada. One is a bioidentical formulation that your doctor can prescribe. And the other one is actually a natural estrogen that is obtained from animals. Some women may need a progestin as well, but you only need that if you still have your uterus. Women who've had a hysterectomy don't need a progesterone.
You mentioned about bioidentical hormonal replacement. What is it?
So bioidentical is often confused with compounded, all-natural, non-prescription formulations. So there really isn't a good definition for bioidentical. The media essentially made this word up, but what it means is it's the same hormone that your body makes. So our ovaries make a certain type of estrogen and also progesterone. But you can get synthetic versions of these medications as well. Your doctor can prescribe both bioidentical or a synthetic version. Some women are wondering about compounded formulations. These are not prescription drugs. They are not prescribed by a doctor, and they don't have regulations from Health Canada to control their use. So these are typically not safe for women to use.
Now, so is there any side effects of hormone replacement therapy?
The side effects of hormone therapy are similar to that of the birth control pill. Because women are older when they take hormone therapy, they still have a risk of a heart attack or a blood clot. But again, that risk is quite small if you're less than the age of 60 or less than 10 years out from your last menstrual period.
Are there any dietary supplements or supplementary components which can one take instead of taking hormone replacement therapy?
As far as I know, there are no studies to prove that one dietary supplement works over another when you compare it to placebo or a sugar pill. That being said, I have lots of patients who use various over-the-counter things. Most of these medications or herbal supplements contain soy. Soy looks like a fake estrogen to our bodies, and so it can act on the estrogen receptors in our bodies as well. So I'm sure that soy does act in a way that helps with hot flashes and night sweats. The danger is that for women who aren't candidates for estrogen and take soy, we don't really know about the effect on their bodies in terms of cancer risk and blood clot risk, because there are really no regulations on these natural products.
So in addition to taking hormone replacement therapy, what sort of precautions one woman should take in the menopausal and postmenopausal age to screen for different types of cancers, or what sort of recommendation would you give?
So in general, menopause or perimenopause is a great time for women to reevaluate their health and maybe pick up on some slack because they've not taken care of maybe parts of their screening or maybe fitness or nutrition because of other obligations in their lives. Usually in the perimenopausal time, typically women's children are getting older, their jobs are becoming less hectic. So it's a great time to visit your family doctor and talk about what screening is necessary. Typically, mammograms start around age 50. Women can also inquire about bone density screening, colonoscopies or fecal occult blood tests, so that's checking for colon cancer, and then Pap tests are every 3 years up until the age of 70.
Thanks. And then how can one find a menopause specialist? Is there any menopause specialist, or one has to go to the family doctor for this?
Well, some gynecologists do extra training and actually become menopause specialists. We don't have any in Thunder Bay, but all of the gynecologists that work in the city do know how to look after women with menopausal issues. A lot of family doctors do as well, and so I would recommend that people go see their family doctor to see if they can help, and if not, they can get a referral to see a gynecologist. If women don't have a family doctor, then they can try a walk-in clinic.
Thank you, Dr. Power, for coming to the show. Really appreciate your time.
Thank you.
Thank you, everyone, for watching the show.